Each year, over 40,000 women will die from breast cancer. Despite billions of dollars being spent on research, the health outcomes have not improved in 30 years. What has increased is overdiagnosis and overtreatment. On the front lines of the race for a cure is Dr. Laura Esserman, director of the Carol Franc Buck Breast Care Center at the University of California, San Francisco.
I will show him America, and he will ride on the wheels of a dream. Here it is. This is the plan to conquer the world. Okay. Of healthcare. Healthcare costs in this country are higher than they are anywhere in the world. Our outcomes aren't better. Last I checked, in breast cancer, there's still 40,000 women a year dying of their disease, and nobody, as far as I can tell, really loves our treatments. So we have to do better. You see this one? There have been reports of an increase in chatter among the women.
In addition to being a world-class surgeon, Dr. Esserman has sparked a revolution in breast cancer research with a 5-year, $14 million grant for her Wisdom Project, addressing the inefficiencies in breast cancer screening, and the Athena Breast Health Network, a collaborative data-sharing platform.
So Wisdom is women informed to screen depending on measures of risk. And it's part of our Athena Breast Health program. And you know, the only way to do better is to know better. That's a great Maya Angelou quote, right? So the only way forward in screening is for us to know better. And for that, we need people to share their story, share their wisdom, participate with us. Every woman spends 30 to 40 years getting screened. Might as well take 5 years, help us move the field forward, make it better for them, make it better for their daughters, make it better for their mothers, make it better for every woman that'll come after them. One size doesn't fit all for treatment, so it can't possibly be that we should screen everybody the same, because everybody is not at risk for the same cancer. The controversy around screening is based on data that is 40 years old. We need to generate new information to learn and find out who's at risk for what kind of cancer. As we start to learn who is at risk for what kind of breast cancer, we can actually do a much better job of prevention. That's what the Wisdom model will do for us.
So of the 126, 51 patients meet our inclusion criteria. And
so that's no surgery, right?
Yeah.
I'll review the data, and then we're going to talk about some of the microbiome stuff. I'm just trying to figure out what do we know about these people who have done nothing and are being followed, and where are they? And I had this total harebrained idea, which I'm super excited about.
Okay, so
that is actually the most exciting thing that's happened already. Mike doesn't think it's harebrained. That's even the best. And he will ride.
Dr. Esserman's unique philosophy as a surgeon includes singing to her patients as they go into surgery and exploring innovative approaches to breast cancer treatment, often overlooked by the medical establishment's current standard of care, like the iSPY clinical trials.
The standard of care isn't so great. It's the best we have right now, but as I said, there's still people dying of the disease. The treatments are toxic. We should be wanting to make it better. So iSPY is really about getting the right drug to the right patient at the right time. The people who are most at risk to die of breast cancer are the people who have aggressive breast cancers with early recurrence. And one of the things that we're trying to do is figure out how can we improve much more quickly on the treatments that we offer people. So instead of testing drugs first, when people have stage 4 disease, when we really haven't been able to cure them, I want to take those promising agents and test them up front in the women who have the highest risk breast cancer. And the idea is to have this kind of seamless, this engine, we keep the engine running and we keep trying new things. And as we find new treatments, we build on them. And we can rapidly move those forward and pick those ones that we think have the highest likelihood of succeeding. And we're shortening the time it takes to learn that. Don't you want to see the data?
Yeah.
I want to see the data. And are you guys working out what you think it's going to cost to sort of like slice the tumors, do blah, blah, blah? And I don't know if it would be enough to overcome it, but the people who seem to do worse in iSPY are the people whose T cells are present but turned off. And this is something that could actually turn on the T cells, right? It's an immune stimulant and it's cheap. No one will make money on it, which is somewhat of a problem, but we can still, we can raise money to test something that's cheap and easy. What we're looking for are solutions that promote healthcare value. Better outcomes with less resource, interventions, expense and trauma to the patient. Our goal should be to do things better tomorrow than we do today. So that's what Wisdom and iSPY are all about. But we're trying to make tomorrow come a lot faster.